This video is on viscosity, or how thick or thin the blood is. So here we have an example of thinner blood. So as you notice, when I swirl it in the glass, it doesn't stick to the glass, it just kind of slides back down the side. Over here we have an example of more viscous or thicker blood, and it's exaggerated for effect, of course, but as I swirl it, it kind of sticks to the side and it is thicker. So if you were to think about these two fluids, or fluids of these two consistencies moving through blood vessels, which would flow more easily, do you think? As we increase viscosity, we increase peripheral vascular resistance. Even if we have similar systolic blood pressure, we're going to increase peripheral vascular resistance and decrease blood flow. So what kind of factors decrease viscosity? Well, as this is flowing through the blood vessels, flowing a little more easily, hydration, of course, can affect viscosity. That affects the fluid portion of the blood. Systole affects viscosity. Viscosity actually decreases with applied stress. That's because blood is a non-Newtonian fluid. It has some properties of both solids and liquids, kind of like oobleck, which you might have played with in preschool, and ketchup. It's another example. Ketchup, if you ever try and get it out of a glass bottle, you can't really do that until you apply some force at one end of the bottle, and then it kind of flows out very quickly. So those are some examples of things that decrease viscosity of blood. Things that would increase viscosity, and as you notice, this is a little bit more gloppy, or a little bit more harder to flow, I guess. So dehydration then, of course, would increase viscosity, because that's also affecting the fluid portion of the blood. Diastole being the opposite of systole. Lower body temperatures. This is why we keep operating rooms so cool. We want to kind of decrease the likelihood that our patients are going to bleed too much during surgery. Stimulating certain clotting factors will also increase viscosity, and this is one component of Virchow's triad. And having elevated red blood cells, as in something called polycythemia vera, which is a very rare, slow-growing blood cancer, can also cause an increase in viscosity. And an increase in viscosity can increase peripheral vascular resistance, decreasing blood flow, and can cause problems with our blood pressure. And that is the end of this demonstration.